Hi, welcome to another edition of Ask the Expert on Fox 4. I'm your host, Tana Guthrie, and today we're talking about fat. Yes, that three-letter word, specifically CoolSculpting. And my expert today is Dr. Cristyn Watkins. She is owner of A New Aesthetics and Optical Wellness. Thanks for being here.
Thank you.
Okay, so what you're offering sounds too good to be true. CoolSculpting, you can get rid of fat. It really works.
It really works. We've been doing it for a couple years, and the reason we brought it in is because the technology is real, and it really fills a void from people who don't want to undergo the knife and have just small fat pockets that they can't get rid of with exercise and eating right.
So how does it work?
So it's a big technical term called cryolipolysis, which essentially means that it kills fat cells. So what we do is we apply the applicator to the area. That's kind of what you can expect. What it does is it freezes that area of fat, and then that fat literally melts away over about 2 to 6 weeks. Your body resorbs it and gets rid of it, and
it won't come back.
It will not come back. So every time you get the treatment done, you lose 20 to 25% of fat in that treated area.
So we're born with a set number of fat cells.
That's absolutely correct.
And when we get fat, they just get plumper, but we don't make more fat cells.
Correct.
So you're getting rid of them.
So we can actually get rid of them. That's the beautiful thing.
Now, what's the downtime?
So downtime, there actually is no downtime. One of the things that some people may experience is a little bit of swelling and discomfort in that area for a couple days. Some people will get pins and needles in that area as well, but that's pretty rare. So there's zero downtime. Unlike surgery and other things where you have a lot of downtime, pain, swelling, take medications, time off work, you literally can go and do something the very next couple minutes. It's that easy.
So that's the only side effect, just a little discomfort, maybe some tingling.
Correct. Maybe a little swelling in that area for a couple days.
How long does it last? So it's permanent?
It is permanent. So once you get rid of those fat cells, it is literally fat cell death, and they're gone forever.
And how long does it take to see the results?
It takes about 4 to 12 weeks. So at about 3 to 4 weeks, you'll start to notice, and at 12 weeks is really when you're at your optimal. However, we do have some patients that even at 6 months, they still notice some diminishing of the area of the fat.
But at least in 12 weeks, guys are going to start whistling at you again.
Absolutely.
They should.
Absolutely.
So how many treatments does it take?
Anywhere from 1 to 6. It really depends on the area. There's 9 areas on the body that are FDA approved for CoolSculpting, everywhere from the submental area, which is the chin, to the bra fat, the arms, the belly, the flanks,
Back
the
fat,
thighs,
bra
back
fat,
fat, bra fat. So it really depends on the area, and it depends on how much fat you have in that area. So some people under the chin, it might be 1 treatment, and some people in the abdomen, it could be 4 or 5 treatments, really depending on what your goals are and how much there is to lose.
Are there any people you turn away?
There are people that we turn away. Sometimes we feel that the patient might be a better candidate for surgery or a different option. There are a couple contraindications to the procedure itself, maybe a hernia in the area, or there's a couple blood disorders that we have problems with coldness. So this is a procedure where we freeze fat. So if there's an issue there, that person might be turned away, but it's very rare. But the one important thing is picking the right candidate and the person who's appropriate for the treatment.
Do people sometimes, though, have unrealistic expectations?
Yes, I think in this industry that can happen with everything that we do with aesthetics and wellness, but we're very good about going through with the patient, giving them realistic expectations. If we think that they're wanting a surgical result that we don't think we can give them, we'll tell them that surgery is a better option. However, there are patients we can give a surgical result to, and those are the patients that we really strive to bring into our practice and help.
So somebody told me that you've actually done CoolSculpting yourself.
That's
and you're
right.
a babe. You look great.
That's
you don't
right.
need CoolSculpting.
You know, the crazy thing is we all have pockets of fat. So I'm a functional wellness physician. I practice what I preach. You know, I'm very into health and wellness. But I did do my flanks. We
and
all
your
have
flanks are the
back here, the little muffin top, the little back fat that puffs
okay.
over the jeans. So I did 2 treatments back there, actually on both sides. And I even posted it on social media, of course, of myself
It is
getting
so brave
treated.
of you.
But I really believe that as a physician, if you're going to bring something into your practice, you should try it and know exactly what your patient's going to experience, and also to know what results you can expect.
So how long did it take to work on you?
So it took about 4 weeks.
Okay.
So I did 2 different treatments. 4 weeks later, I had my second treatment just because I wanted to reduce more of that pocket of fat.
Right.
Why not? So that's one thing about CoolSculpting. It's kind of like some of the other aesthetic procedures we do, right? Where it's addicting because it works.
Right.
So you lose 25%, you want to lose another 25%, you want to lose another 25%. So that's also goes into how many treatments people want, because sometimes they end up wanting more because they really see the benefits.
So how cool is it, since you've done it yourself? Is it like having somebody put a popsicle on you and leave it for 5 minutes?
That's exactly what it feels like. But after about a minute or two, once that area is frozen, you don't feel it anymore. You don't feel it at all. And we also have another medical device that once that suction is removed from the CoolSculpting machine, that we use to help massage the area, because massage improves results, but it also takes away that area. You have to massage it, because if you can think of it, it's like a big block of frozen butter, if you will, and then we
Right.
massage that out. And it's really amazing how you can lay there. You can literally be looking at, for me, of course, I'm looking at my phone and email and texts.
Oh, while they're doing
while
it?
you're getting
Okay.
your fat frozen away. So we have a nice private room where you're in there by yourself. You can turn off the light if you want, but most people either go to sleep during the procedure, or they're checking emails, watching a movie, something like that on their iPhone device while they're literally getting their fat reduced.
Now, I read that you are a cool hub, and I have no idea what that means, a cool hub.
Yep. So a cool hub, there's not very many in the United States. We were chosen to be one earlier this year. And what that means is we actually train other facilities and other physicians how to cool sculpt. So they chose us just because we do a significant amount of cool sculpting and we get great results. So they asked us if we would be interested in that and how to train other centers how to get the results and how to do cool sculpting like we do.
So if you're looking for providers who do this, what kind of questions should you ask?
Sure. I think it's really important, no matter what type of medical procedure you get or aesthetic procedure, to ask certain questions. So if you're going to have this procedure in particular, I would ask them how many they have done and how long they've been doing it. If they have any before and after photos, that they can show you some of their actual results instead of some stock photos. Other things are, have they been to CoolSculpting University? Do they have trained providers that have actually been to their university where they've been certified?
Should they have a doctor on staff like you?
I absolutely believe that you're going to get better results and better outcomes when you have a physician on board. There just brings another level of standard of care, I believe, to that facility. And I'm there supervising all of my staff and training them. And one other thing is that I really make sure that we are the top at what we do. So being a cool hub, having 4 to 5 of us that are CoolSculpting University trained at all times, I think is really important.
I would like to see it done.
Absolutely.
I mean, do you do that? Can somebody come in and watch it being done?
We actually do that. A couple times a year, we have what's called a cool event. So it's a cool sculpting event or body contouring event. And during that event, which you can do, not only can you get great discounts, of course, but what most people come is they actually can see the patient being treated live in front of them. So we do a talk, we do a seminar, we show our before and after photos while the patient is in the front being treated. We watch
in front of everybody.
In front of everybody. Right. And then we also do complimentary consultations after the talk, and you can also go up to the person, talk to them while they're being treated, see how comfortable they are. So it's a great way to really, as close as you can, to touch and feel what's going on.
Do you have everybody wanting to volunteer? Please pick me.
Of course we do. Of course. So, one of the perks of being the model is you get your treatment for free that day.
Right.
So we actually have people all the time asking us if they can be our model. Yeah.
For those who have questions, how would they contact you? What's
Sure.
the best way?
The best way is always to start your research with the website, which is anewaesthetics.com. The other,
And that's ANU.
correct, ANUAESTHETICS. So some people spell aesthetics with an A or an E,
Right.
The French way or the American way. The other thing is just to call our office at 816-359-3310, and we offer complimentary consultations for cool sculpting all the time. There's no obligation. You can come in and meet our master cool sculptor. Her name is Nancy. We also have another nurse, Kelly, and you can come in and get a consultation for free, and we can tell you what that looks like. And we're very upfront and very honest. We don't try to just tell you that it's going to be 1 or 2 cycles. We're very upfront with what the full
Right.
treatment to transformation looks like, so that you can be happy with your results when you're done.
All right. Well, thank you for coming in. This has been very
Absolutely.
interesting.
Thanks for having me. I appreciate it.
Join us next time for another edition of Ask the Expert on Fox 4.